give the floor to Honorable Balasuria, State Minister of Sri Lanka.
Thank you, Your Excellency. His Excellency Liu Shaohui, Vice Foreign Minister of China, and Your Excellencies, let me start by commending the initiative taken to organize this meeting. Sri Lanka, as a developing country of 22 million people, has been able to effectively contain the spread of the virus with limited resources and limited external assistance. As of today, Sri Lanka has had 36 deaths and 14,000 COVID cases. All of them are either those who arrived from abroad or have been identified as belonging to a particular cluster. Sri Lanka's President Gotabaya Rajapaksa's early intervention led to the establishment of a presidential task force for prevention of COVID-19 in January 2020, bringing together the health sector, Sri Lankan armed forces, police, intelligence services, the foreign ministry, and many other state agencies. Sri Lanka understood at the beginning that this was a challenge that all agencies of the state had to collaborate and work together on, and not a task that could be handled by the health sectors alone. A national strategy has adopted and is being constantly reviewed by the task force. The National Operations Center for Prevention of COVID-19 has also been set up to implement the strategy. The national strategy contains four main elements. A, identification of infected persons. B, contact tracing. C, quarantining. D, medical treatment. All identified patients are subjected to testing, and dedicated public hospitals have been established island-wide to create COVID patients. International care center, I beg your pardon, intermediate care centers have been set up for asymptomatic COVID patients. Another aspect of our strategy is the very effective contact tracing methods used by our security forces and intelligence agencies in identifying the infected persons and their contacts. Contacts of reported COVID cases are subjected to home quarantine for 14 days, and the government has provided dry ration packs to these families. Sri Lankans returning from overseas are required to quarantine for 14 days at designated quarantine centers. Among the multiple measures taken to prevent the spread of COVID-19 includes localized lockdowns, limited inter-district travel, and discouraging movement of individuals. In addition, steps have also been taken to introduce work from home concepts to schools, universities, and also places of work to prevent social distancing. During the lockdown and curfew, the governments effectively carried out home delivery of foods and other essential items. Airports have remained closed, and successful arrangements have been made to bring back Sri Lankans overseas, particularly immigrant workers, students, as well as sick and the elderly persons. Sri Lanka has so far repatriated over 44,000 Sri Lankans from overseas, and all of whom were subjected to PCR test and quarantine. The 67 Sri Lankan missions abroad, in coordination with the Foreign Ministry, play a key role in registering Sri Lankans and repatriating them on a priority basis. Another pillar of Sri Lanka's COVID management is the very effective public health system throughout the country. Our public health inspectors play a key role in maintaining contact with the people at ground level, ensuring that quarantine regulations and health guidelines are followed. The public have also effectively contributed by cooperating with the authorities and adhering to health guidelines. Several voluntary organizations raised funds and donated much needed medical equipment and protective gear. Primary among the challenges that the government has to deal with is the loss of employment, particularly workers in the informal sector and the low income groups. The government is providing cost of living grants, concessionary loans, and have negotiated with banks and leasing companies to provide relief to the people. Programs to distribute ration packs and a payment of monthly allowance for families among low-income groups have been implemented in areas under lockdown. Sri Lankan companies, including major exporters of apparel who are affected by the distribution of global supply chains and international shipping and air transport, are also assisted by the Foreign Ministry and Sri Lankan missions abroad by securing orders from overseas for protective gear to fight COVID pandemic. Our companies proved their resilience and innovativeness by rapidly transferring their production to manufacture of facial masks, PPEs, and other essential protective gear. Thus, Sri Lanka can also claim that it helped to save thousands of lives worldwide by supplying protective material at a short notice worldwide. This also helped to secure jobs of workers. The government has also provided relief measures to industries heavily affected by the pandemic, including the tourism and hospitality industries as well as small and medium-scale enterprises. Similar to Sri Lanka, a large number of countries have been severely affected by the onset of the pandemic. This includes the traditional donor community that usually supports Sri Lanka at a time of a crisis. Therefore, during the course of the pandemic, external financial and material support to Sri Lanka has been limited. While Sri Lanka appreciates the support received from donor countries, including China, which provided equipment and medical supplies, there remains a significant shortfall in resources in the wake of a second wave. As the world looks on in hope of following positive developments regarding a potential vaccine, we now settle in what is a new normal. However, several social and economic impacts of this pandemic are expected to be long-lasting. This is why now more than ever, countries need to be partners that support each other in navigating uncharted waters of post-COVID world. In this backdrop, it is vital that countries like Sri Lanka receive assistance in obtaining rapid testing equipment, ventilators, and sharing of experience in diagnostic and treatment and medicine. We also need support for early access to vaccines that is affordable to developing countries. A closer cooperation and sharing of experience on border controls across border transmission, containment measures at point of entry, and emergency response is also needed. Assistance and sharing of experience on economic recovery, including debt relief, is a must for future economic development. Cooperation to ensure smooth functioning of industrial and supply chains is also an essential aspect of ensuring that our economies will function in a post-COVID environment effectively. While thanking the organizers for putting together this timely meeting that opens up a dialogue between our countries, I urge that we continue with this initiative to strengthen the practical cooperation in fighting this pandemic and look forward to a world free of COVID in the near future. Thank you.
Thank you, Excellency Balasuria, Minister Balasuria. Thank you.